All right, welcome everyone to today's meetup. My name is Jessica Kim from the University Career Center, and today we have inside look at Novant Health, mission, impact, and careers. And so we have Travis Wright from Novant Health, and he will be leading the small group discussion. So Travis, take it away.
Yeah, absolutely. Super excited to be here. When I was creating this slideshow, I had a really hard time with it because there was so much that I wanted to share, but I know that our time is quite limited. So I did pack a lot of information in here for you guys to learn a little bit more about who we are at Novant Health. So a little bit about myself. I actually come from a career service background, working in higher education for several years. I still do. I teach at Queen's University part-time. But in addition to that work, I helped launch our campus recruitment team at Novant Health 2 years ago. And we were a team of two, and now we're a team of nine. So we just keep growing. And what we do is we travel to college campuses. I was actually at UNC Charlotte yesterday to help kind of build our brand, share our brand, and connect students with opportunities across the system. So we're going to kind of dig in a little bit about that. I'll share some more information about different career opportunities across the system. But I also wanted to give you a good broad overview of Novant Health. Oftentimes, when we think of healthcare, we think of the clinical side only, right? But Novant Health is a huge enterprise. So I wanted to put some numbers behind that. So right now, currently, Novant Health, we have 19 healthcare centers across North and South Carolina. These are our big hospital facilities or where you would go for acute care services. And we continue to grow. In fact, we just added 3 hospitals to our network in South Carolina, in Hilton Head and Charleston area. We're also in a partial merger with Conway Medical Center in Myrtle Beach. So if you go to Myrtle Beach and you see Conway Medical Center, that's now one of our hospital systems. But primarily, our healthcare system, or what we call our legacy markets, is in Charlotte, Winston-Salem, and Wilmington. We recently merged with New Hanover Regional Hospital, actually, when I started at Novant back in 2021. We have one of the largest medical groups in the country. We have over 2,000 physicians and 800 clinics. We also have 50 freestanding imaging centers across North and South Carolina where folks can get imaging done at those facilities. And to kind of help make healthcare accessible, we launched a partnership with Michael Jordan and our foundation. And we opened 2 family clinics in North Carolina, Charlotte region. We're getting ready to add 2 more to our network in Wilmington. And those are sites for folks that can't really afford healthcare or don't have insurance. So they can go there and get a lower cost for medical expenses for different procedures. We are the only healthcare system that is affiliated with St. Jude Children's Research Hospital, too. So that's another cool fun fact about us. And then we were also ranked as North Carolina's safest care provider by Leapfrog. So that was also a new announcement just this past quarter. So there's a lot of things going on at Novant Health, but our system is pretty large. Like I said, 19 facilities, 800 plus clinics. But we're kind of going through a transformation at Novant Health. In the past, pre-COVID, healthcare was seen as like a delivery model. You go to the hospital when you're sick, or to your doctor's office when you're sick, or you need to do an annual physical or things like that, and then you were done with your healthcare needs, right? Well, we're kind of changing what that looks like and how Novant is really weaved into the community and the communities that we serve. So Charlotte, Winston-Salem, and Wilmington primarily, adding South Carolina to our network just a couple weeks ago. So there's going to be some big transformation there. But what we're doing is we want to transform Novant from a delivery model to what we call a total wellness model. And so I actually got permission to share this slide with you because this is actually private proprietary information that we just got trained on a couple weeks ago. And this graphic is kind of a symbol of what that total wellness model looks like. And so you'll see some symbols in here, like a spaceship down below. That's really part of our foundational strategy of incorporating innovation to the care that we provide in our communities. So a lot of really cool stuff with AI and technology that's happening across our system. I'll show you some graphics here in just a bit on what that looks like. but you'll see home, digital, workplace, clinics there in the top right. That's kind of symbolizing all the places where we are extending our healthcare services. So, for example, of course, home. We recently announced that we're doing hospital at home. That's a really cool initiative that we launched in the Wilmington market. We were the first hospital in the state of North Carolina to do so, where folks don't have to go to the hospital, but to get the hospital level or what we call acute care that you would receive in a hospital. So, really cool how technology is allowing us to extend our services in the home and digital. But you'll also see workplace. And that's relatively new for us. So we actually have an enterprise team that is providing healthcare at some of our corporate partners, including Bank of America, Food Lion, some of those big companies where a lot of folks work in these big office buildings. We now have sites there for their team members to get healthcare on site, which is really cool. So that's part of that transformational strategy that we're working on right now. But there's a lot packed in this image. And that kind of ties to our cause. And you'll see that in the top right corner, but I bring it here for you. We, in the past at Novant Health, had a mission, a vision, and values, but it was pretty extensive and it was not easy to remember. And so what we did is as part of this transformational strategy at Novant Health, we launched our new cause statement. And we announced this back prior to the holiday season in the last quarter of 2023. But this cause statement really brings together our mission, vision, and values into a simple cause statement that all of our team members can easily remember if someone were to ask us, who is Novant Health and what is your purpose? And so that purpose is, creating a healthier future and bringing remarkable experiences to life. And there's 4 different pillars. So kind of bringing those values together into these 4 pillars. So we have discover, empower, thrive, and together. My favorite's together because having such a large enterprise with 40,000 plus team members, there's a lot of cross-functional work happening. While I work in people and culture, I primarily recruit for our nurse residency program. Well, my work is making an impact in everyday lives of folks that are coming to our facilities that are working with our nurse residents. So that's just one example of how my work is making an impact in the hospital systems, even though I don't directly work in the hospital systems. Another example would be our innovation team. So we have an entire team, or digital products and solutions and services team, where they partner with our physicians, they partner with our other clinical areas across our system to bring innovation and technology to those areas. And so that's another way that we work together. I also love the empower pillar, where we have to empower each other to provide that remarkable patient experience and safe experience that we're known for. And so I really like, as part of that pillar, it talks about shared accountability and action, but also how we work together and empower each other to serve our patients, families, and the communities in which we're located. So I really like that pillar too. And so this data was actually just announced yesterday. So you get to see it. You're the first group that gets to see it, I think, that I've shared this with. This is to just kind of show you our overall impact in the 3 communities that we were in 2023. So this does not include South Carolina just yet. There's some pretty big numbers here, but something to highlight was our digital health visits on the top right. That's new for us because just within the past couple years, we have added teledoc and all these, or what we call TIDO services for folks in our community to get access to us, our services, through digital means. So for example, TIDO is a really cool device. In fact, all of our team members, when you join Novant Health, you get to check off if you want a TIDO device, which is really cool. And it's a kind of like a little computer, small handheld computer that you get to keep at home. And anytime you need access to a doctor, you can just log in and get access to a doctor pretty quickly on that device. So we have started extending those services to patients now. And so, yeah, so that's that digital health visits number there, which is pretty exciting. That's a new addition to our data. But you'll see there's a lot of patients that come and visit our system at both our clinics. So you'll see 6.8 million visits alone just in our medical group, or that's what we would call our ambulatory setting, our physician clinics. That's a lot of folks that are coming and visiting us for many reasons to and getting to that Novant experience. You'll also see here we had 602,000 ER visits. Really exciting for us is that our emergency services in Charlotte was just reached level 2 trauma, which is really exciting. I know the trauma folks in our facilities in the ER and critical care, they're really excited about it. Me, not so much. I don't like blood and guts and all that stuff. Couldn't do that, but they thrive in that environment. So we are now level 2 trauma, so really excited about that. And that's part of those ER visits. You also see that there's 175,000 total surgeries that were happening in our hospitals across our systems. That's a lot of surgeries. And then another cool fact down at the bottom, babies, 22,000 babies born at Novant Health. So we actually have just announced that we are remodeling a lot of our women's health units across our facilities. In fact, Kernersville Hospital, so if you're from that Winston-Salem market, you'll see that they just recently opened their new women's health and labor delivery units, which is really exciting and really cool. Some really cool technology happening in our women's health areas in our hospitals. But I love this slide because it shows the impact that we have across the state of North Carolina. There's a lot of great work that's happening at Novant Health and our facilities. And this is really bringing our cause statement to life. You know, this is my favorite slide because I was able to go in this morning and kind of pick and pull different things that are happening at Novant Health or recent announcements that are happening and shared in our Healthy Headlines, which is kind of our internal newspaper that we have across the system. But I wanted to kind of share some recent developments. And so on the left-hand side, you'll see some graphics of upgrades that we're doing across our system in our hospitals. So at the top is actually Matthews Medical Center. If you've ever been there, it's close to you guys. We're adding an entire new critical care unit wing there. That's about a $500 million project. So that's a really big capital expense for Novant, but it's going to bring, it's really going to take care to the next level in that area of the city. The images below that is Forsyth Medical Center. That's actually our largest hospital in Winston-Salem. They are adding a new critical care tower there too, which is really exciting. And then down below, we're building a new hospital in the Wilmington market in Scotts Hill. So really excited about that. Again, expanding our footprint across the coastal region. So there's a lot of work happening there too. And then Ballantyne Medical Center there at the top, recently opened that this past summer. So they're almost at their 1-year mark, but a lot of great work happening there too, as we added new team members there in that community to help serve the patients that live there. So really excited to kind of extend our footprint on the western side of the city. Like I mentioned, we are expanding across South Carolina. So we added 3 hospital systems to our market. Down below, you'll see some images. So like I said, Novant Health was recently announced that we're the safest healthcare provider in the state of North Carolina. All of our hospital facilities reached a level A for Leapfrog, which is pretty outstanding. So we're really proud of that. That just goes to show all the work that's happening cross-functionally within our hospitals to make that happen. As part of that cost statement, so again, extending from that delivery model to a total wellness model, one of those pillars of that model is music as health. And so we recently announced last week, actually, that we're going to be the lead sponsor for the Charlotte Symphony Summer Pop Series, which is a lot of fun. I used to go to that every summer with my family. I'm a musician, my partner's a musician, so we love that. So it's really cool to see that Novant Health is investing in that activity so that it can remain free for people in the Charlotte community to attend. Some other projects that we're working on in our community. You'll see Food Lions listed here. This is actually something I shared last week with a group of students at UNC Charlotte that we're really excited about. But food as medicine is also part of that of our cause statement and extending outside the hospital, where we are now tracking our patients that might be food insecure and providing them free meals so that they do have the nourishment to get better after they visit our facilities. So that's a really exciting partnership with Food Lion that we are now extending across our Charlotte region and also our Winston-Salem region. We're also close partners with American Heart Association. We actually just launched a new partnership with American Heart Association to expand training that they provide, so basic life support for free for community members. So that's a really exciting partnership that we have there. And then, of course, Nourish Up, which used to be Loaves and Fishes. They just rebranded this year. And we've been a close partner with them, again, helping get food into our communities where folks might not have access to food or can afford food. So really excited about Nourish Up. We are a really strong partner with them. And then on the bottom right, I'm really excited about this as our community care cruisers. This is really us extending our services again out into the community where folks do not have access to quality healthcare. And so we have several care cruisers in the Charlotte region in partnership with Truist Bank. They helped fund those for us. And we're getting ready to launch care cruisers in our Wilmington market, which is also really exciting. Because Wilmington, that area there's a lot of poverty in the Wilmington market. And so this is just one example of how Novant is investing in that community to extend our services to folks that live in the Wilmington region. Some other things I'll quickly point out at the top that we've been noted for: Diversity MBA. We was recently recognized as a top place to work for women that identify in different backgrounds. So really excited about that. We also were ranked best place to work in 2023 with a score of 90 for the Disability Equality Index with Disability In, which is really exciting. And then we have recently ranked with Forbes as best America's in-state employer for North Carolina. And then I'm also very passionate, since I lead recruitment for nurse residency. We're the only nurse residency program in North Carolina that's nationally accredited with distinction. So really excited and proud of that, because I know our nurse managers that run that program work really hard to get that accreditation and maintaining it. And then last but not least, Novant Health. We love our nurses. We have about 9,000 of them, nurses across our system. We were recently recognized as the longest running hospital in North Carolina that's magnet designated. And so what that means is that our nurses have a shared governance model across our system, and also included in that is education. So Novant Health invests a lot of money in the education of our nurses, and we have a stamp of approval for that. Only 5% of hospitals in the country can claim that they're magnet designated. And so what does this mean for you, right? And in terms of careers at Novant Health, I think, like I said earlier, when students think of healthcare, they think of clinical opportunities only. But we are a huge enterprise. Like I mentioned earlier with the trauma, you do not want to see me working in a hospital. That's not where I would want to work. But I work on the people and culture side, so the corporate side of the business. But I wanted to kind of provide you a breakdown of the 5 different hiring areas that we have across our system. And so first is our medical group. This is going to be our ambulatory setting or the clinics. So where you would most often go if you need services, things like an annual physical or a yearly checkup with your doctor. That's going to be our fall within our medical group. And so these are just some of the different positions that you would see within our medical group. So ambulatory nurses, so those are nurses that work at those clinics, not necessarily our hospital or an acute care setting. Clinic administration, so folks that when you visit a physician clinic, the folks that are helping manage your insurance, scheduling your appointments. We have medical assistants that help our providers, of course, our providers, physician assistants that are there too. We have patient service coordinators that also help with our medical or clinic administrators to make sure that you're getting good customer service when you visit our clinics. And we also have scribes. Our acute care, what we used to call allied health, but we recently changed it. These are folks that are focused on complete and total wellness of our patients. And so you're going to see a really good mix of folks that work in our allied health. And so some of those would be occupational therapy, pharmacy. We have mammogram or mammographers that help do that kind of work. We have lab assistants and lab technologists, physical therapy, and also physical therapy assistants, radiology technicians. Those folks would kind of fall within that acute care or allied health services. Nursing is pretty self-explanatory, but there's a lot that goes into nursing. There's a lot of layers in nursing. And so some of those layers, of course, working in acute care or ambulatory care. We also have midwives. Those would fall under nursing support. We have nurse aides, or what we, and you have to have a CNA credential to do so. We have nurse practitioners. So for those nurses that want to further experience their experience and kind of help our providers, you'd have to, of course, go through more schooling to do so, but that's an advanced level nurse. We also have nurse residency programs. That's where I help. I help support that program. And of course, we also have nurses that work in hospice care. Student programs is pretty small. Our student programs team, they really help coordinate our clinical experiences for any student that's in a clinical program like nursing or pharmacy, things like that. So they help manage those programs for our system and hire students into those clinical rotations. And of course, non-clinical, that's a big group of opportunities there because it's so big. Our corporate side of the business is what keeps this system running, right? And so I just kind of picked a few of those areas listed here. So supply chain, I get a lot of questions from students that are interested in supply chain. So they are the folks that help get our equipment out to our facilities. We have marketing and communication. So as you're driving down 77 and you see those purple billboards as you're driving through, that's the team that makes those happen. They help create all of our marketing brochures, our TV advertisements. Typically, if you watch the Super Bowl, they typically launch a commercial for that event. So that's really exciting. So that's all the work that they do just within marketing and communications. We also have education and training team, occupational health. That occupational health might confuse folks, but occupational health is kind of like our internal healthcare system for team members. So they do things like drug screens and background checks for folks when they're joining our team. When during COVID, they made sure that we were in compliance with national standards for COVID by checking our immunizations and things like that. So they are really busy in occupational health. We have a government relations and external affairs. In fact, we just launched a new team that sits in Raleigh to help drive different policies and bills that are being passed in Raleigh focused on healthcare. So really exciting and cool endeavors that they are working on. That team was announced back in December. So all that to say, there's a lot of folks that keep the system running on the corporate side. So if you have an interest that's not necessarily clinical, but you have an interest working in healthcare, check out some of these opportunities. There's a lot of them. And like I said, you don't want to see me in the hospital. I do not come from a clinical background at all. I actually studied English when I was a student at App State. And then, of course, as I mentioned earlier, I've also worked in higher education administration. So I do not have that clinical background. So there's a spot for you if you're interested in healthcare, but don't have any interest working with patients directly. And so that being said, I wanted to share with you a link to our career site. That is where it's a really good way to kind of navigate and find different opportunities that are out there. So if you're studying finance or you're studying a humanities program like English or communication, take a look at our career site. There's a lot of really cool opportunities that are listed there for students like yourself. And then also another really good way to get involved at Novant Health is our volunteer group, We have an entire team that manages our volunteer network. And so if you're interested in working in any of our facilities, working on different projects and things like that, you can join our volunteer network. And so I put a link there for you to kind of explore those opportunities and ways to get involved outside of careers and internships. And with that, I'll open the floor for any questions that anyone might have about Novant Health. And feel free to use the chat if you don't want to come off mute. Quiet group. Ellie, what are you studying?
Hey, I'm studying health systems management, so I was actually
Okay.
about to ask a question about kind of the business development and sales section that you just talked about, and kind of what careers would go along with that.
Yeah, there's a lot. So our sales team's working with both technology vendors and also, as you can imagine, pharmaceuticals and things like that, and bringing those services or that equipment or medications to our system. And so they're pretty busy. But there's a lot of different positions packed just within those two areas. You mentioned healthcare administration, correct? That is pretty broad. And so, what I would recommend that you do, Ellie, is if you go on LinkedIn, start finding people that work in positions that might pique your interest. Feel free to reach out to them. Introduce yourself on LinkedIn and build your network. Say, hey, I'm a student at UNC Charlotte. I'm currently studying healthcare administration. Would love to learn more about what you do at Novant Health. And that might kind of help you get a little bit more direction on where you're headed with your major and post graduation. So definitely use LinkedIn. And if you're on LinkedIn, feel free to add me. I can add you to my network. I use LinkedIn a lot. So I'm pretty easy to find.
I think we're already friends, actually.
Yay, awesome. Anyone else have any questions that I might be able to answer?
Travis, I've got a question for you. I know there's a lot of different careers as you just showed.
Yeah.
And I know a lot of those have special skills that are needed and talents. But overall, all those positions, for example, there's problem solving and communication. What other general skills apply to all those positions in
Yeah.
addition to those specialized ones they have that Novant really looks for?
Absolutely. And I'll put in here in the chat because we just talked about this last week for Competency Week at UNC Charlotte. So there is an organization called the National Association for Colleges and Employers. And each year, they typically, or not each year, about every 5 years, they typically share a list of those core competencies that employers are looking for. And they're pretty transferable across all industries. I tell students that those are what is needed to get those first entry-level opportunities within a healthcare system. So I definitely encourage you to visit the National Association for Colleges and Employers website. It's ncace.org. And that's where you can locate those competencies and kind of investigate some of them and evaluate yourself and how you are developing those skills while you're studying at UNC Charlotte. And where you can take those with you beyond school. So that's a really good place to start. Good question, Daryl.
Okay, thank you.
Yeah. And I'm sure the Career Center has a list of those competencies too. So if you want to go visit the Career Center and meet with a career advisor, they can kind of discuss with you what those competencies are and then help you kind of measure how you are reaching those competencies.
Thank you, Travis. This is Brandy. We have a question in the chat.
Yes.
The question is, don't the requirements for healthcare related jobs in Novant at least require a CNA certification?
Ooh, good question. It really depends on the position. So to work as a nurse aide, yes, you have to have a CNA. For nursing, it's not necessarily required. However, I will share a lot of our nurses do go to accredited nurse resident or nursing programs that require a CNA to get into the nursing program. So a lot of our nurses, even though they didn't work as a nurse aide, they do have that credential going into the nursing profession and coming into the nurse residency program. But not all programs require a CNA. So it really depends on the program that if you are interested in nursing, if it requires it or not. But no, not all positions at Novant Health require a CNA. Just a few.
I have a quick question, or I guess two. The first, when you're discussing those core competencies, that was the place where we can actually look at that is NACE, N-A-C-E, is that correct? Or
Yep, I'll put
Okay.
it right here for you. It's nace.org is a good place to start to identify those competencies. I think there's 8 of them in the recent list, which was published in 2020.
Awesome. Okay. And second question about, I guess, the scribes that are at Novant. Do you guys use third-party scribes, or do you actually employ your own scribes, like to actually work for Novant?
We hire within our organization and external, so we use both.
Okay. And I guess last question. So,
Go for
it. In terms of like, your volunteer and internship opportunities, are any of them around the realm of like clinical work, or are they all more so on the non-clinical side?
Good question. So we have very limited internships on the non-clinical or corporate side. Those are typically through partnerships that we have with academic partners. And I think, Jessica, correct me if I'm wrong, we have a couple internships posted for UNC Charlotte, but I could be wrong. I know we have a few at Queens and Wingate, but we're trying to expand corporate internship opportunities. And the title of that is called Experience Novant Health. So keep an eye out for that. Because we're trying to, like I said, expand what those internships look like. On the clinical side, is challenging. And a lot of those internships are more what we would call clinical rotations or clinicals that you have to complete in order to graduate from a clinical program like nursing. And those are for students that are in clinical programs only, just because of liability. And you do have to have a credential to work in those areas. So those can be really hard to come by if you're not in a clinical space. Those are reserved for those students. So I know a lot of our pharmacy students, we have a residency program for students that are in med school, or I already mentioned pharmacy. And then of course we have students in nursing that are doing clinicals with us. We also have sonography and nursing support programs like that for students that are in those programs like rad techs and things. So it's pretty extensive. The clinical opportunities that we do have available. But like I said, it's pretty limited to only students that are enrolled in those programs.
Okay, that makes complete sense. Thank you for answering my question.
Yeah.
One more thing. Okay, so I know that like Atrium, I'm not sure if this is like actually connected to Atrium Health, but there is a Carolina College thing that is, I guess, kind of connected to Atrium Health. Does Novant, I know you mentioned that, like, Novant's, the educational side that Novant offers are for, nurses or, clinical professionals that are already, established in their career and are, gaining more expertise. Does Novant offer anything at like in the realms of like entry level education, or offer any type of credentials for somebody that is coming in without any?
Yeah, so Atrium, I would say probably 10 or more years ago, they acquired Cabarrus College of Health Sciences through their purchase of Cabarrus Medical Center, which is now Atrium Cabarrus location. so just north of you guys at in the university area. And so they do have that academic partner where we do not. Now we do have an academic partner through UNC Med School. So all of UNC medical students, they do rotations at our facilities in the Charlotte market, and also our Wilmington market. So we have a very close relationship with UNC, but we do not have any affiliation with nursing programs. I mean, we have close partners in terms of nursing, but we don't have our own nursing school, if that's what you're asking.
Yeah, that's what it's asking. Okay.
Yeah.
Thank you.
Good question.
Travis, this is Brandy. I have a question in the chat for you.
Awesome.
Sam says, you mentioned that the direction Novant is moving is to a more overall life healthcare approach. Does
Mhm.
this open up for opportunities for people with kinesiology focused jobs like OT or PT?
Yeah, absolutely. In fact, we hire a lot of those folks on the allied health side of the organization. So those are folks that are in ambulatory settings and also in our hospitals. I actually just met an OT recently, occupational therapist at one of our hospitals, and she was sharing me that she's focused working with children with disabilities. And so she extends her services to our in our hospital system at Henby's Children's Hospital. So really cool stuff that they're doing and that side of the business. Good question, Sam.
And Travis, I did look in Higher Niner to see if there were any opportunities with Novant Health at this moment, and there aren't, but would it be okay if students came to talk to Michael when he's here tomorrow?
Yeah, absolutely. So I want to be cautious though, because the internships that we're launching, we're kind of picking select schools for those internships. I think UNC Charlotte's on that list, so that conversation probably hasn't happened yet, Jessica. But I can tap our team and get more information, and we can share that with you.
So Travis's teammate Michael will be here tomorrow at the Career Center for the professional and residents resume refresh. So
Yeah.
he'll be here tomorrow from 11 to 2 at the Career Center. So if you wanted to talk to Michael, maybe get your resume looked over by him, you can come do that.
Yeah, absolutely. Mike, I call him Mike. He's good people, and he can really help you. Any other questions about Novant Health that I can help with?
Travis, I've got another question. You mentioned the partnership with UNC. I saw when you had the
Yeah.
statistics and demographics and all types of things that you all do. I think there were several clinical trials. Does Novant do a lot of research and have a need for undergraduate and graduate researchers?
Good question. I don't know, Daryl. I know that we do a lot of research, a lot of clinical trials are happening within our system. And some of those are in partnership with UNC and UNC Health. But I don't know the extent of the opportunities that would be available for students to get involved in those types of opportunities. So happy to kind of dig in, and maybe I can, once I get some information, I can share that with Jessica to kind of cascade that out to everyone. But good question, Daryl.
Thank you.
Yeah. That's actually, I'll share, we have an entire library team that manages our research library too at our facilities. So that's another cool opportunity that I didn't even know until as I was pulling this slide together of all the different areas that are at Novant Health. So that was a fun fact. Any other questions that I could help with regarding Novant Health? I'll pull up this slide here to kind of show those data points.
All right, well, if there aren't any other questions, like Travis mentioned, you can find him on LinkedIn. And Travis and his team are very engaged with the Career Center, and they're often on campus, often at our events and our career fairs. So make sure you attend our events and come by the Career Center when they're here to meet with them face to face. And so thank you, everyone, for asking your questions and being here today with us. And Travis, as always, thank you for
Yeah.
engaging with our students. And he was here on campus yesterday, so.
What?
And we'll make sure you try to come out and meet his teammate Mike at the Career Center. But thank you, everyone, for attending today's meetup. And I hope everyone has a great day.
Thank you, Travis. Thank you, Jessica.
Yes, thank you.
Thank you, everyone. Bye.